Hello, and welcome to this McKnight's webinar, Innovation in Practice, Attacking the Workforce Crisis with Modern Staffing Strategies. I'm McKnight Senior Living Content Editor Kim Bonvisuto, and I'll be your moderator. The workforce crisis continues to challenge providers, making status quo staffing practices costly and ineffective. During this webinar, you'll learn about a new approach to labor management that prioritizes flexibility for employees, streamlines operational processes, and maintains high-quality resident care. We'll hear from our speakers in a moment, but first we have some housekeeping matters to take care of. First, our sponsors will follow up with participants after today's webinar to provide access to the presentation slides. Next, if you are having any audio problems with this broadcast, please first check the volume control on your device. This is the most common cause of hearing issues. The sound should be coming from your computer speakers. Also, we will have time for questions and answers near the end of today's presentation. If you have any questions about the information presented, please feel free to send them directly to us at any time during this hour by clicking on the Questions and Answers tab on the left. Questions that we don't get to in real time will be answered afterward. Today's program is made possible by support from OnShift, Matchwell, and Premier Workforce Solutions. After this webinar, you can visit the company websites at onshift.com, wematchwell.com, and Premier Workforce Solutions LLC.com. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards and has been approved for 1 clock hour. You must stay tuned to this event in its entirety during the original broadcast to receive a certificate, and each attendee must sign in and listen on a separate computer. Attendees can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can view and save your certificate. A copy will also be emailed to you afterward. And now I'd like to introduce today's speakers. Mark Widka is CEO of OnShift, which provides human capital management software for post-acute care and senior living. Mark works closely with providers on strategic staffing initiatives to increase efficiencies and control labor costs while improving resident care. Robert Crow is founder and CEO of Matchwell, which provides healthcare organizations an alternative way to access more contact or on-demand clinicians without the expense of a staffing agency. Robert is an advisor with multiple startups in the healthcare and ed tech space. Tony Farinella is COO of Premier Workforce Solutions, while also consulting within the post-acute industry. He is co-founder and CEO of the Vocation Depot, a not-for-profit that assists individuals with disabilities obtain meaningful work. Our speakers have a lot of great information to share with you today, so let me now turn the microphone over to Mark to get you started. Mark?
Thanks, Kim. Very glad to be here. Welcome, everybody. Welcome to my co-presenters. Looking forward to an informative session today. So we're living in a very, very difficult time right now. Every fall, OnShift does what we call our Workforce 360 survey, where we survey several thousand post-acute providers to ask them, what are some of your top workforce challenges? And the slide I have here is comparing 2019 to 2020. Obviously, with COVID, things changed a little bit. The biggest shift was finding and hiring qualified staff became the biggest priority, and I'm sure you're all experiencing that today. In 2019, it was the second highest priority. It was behind retaining the employees already had. Retention dropped a bit in 2020 as we saw many very committed staff members stay and really give their all to help us get through the crisis. So that was an interesting flip. And I think that's part of what we're going to talk a lot about today is, what can we do to try to get control of that? But also interestingly is, staffing to meet resident care needs, that is a problem increased by over 50%, as did responding or people working short shifts, not having enough staff. So I think it's very interesting that the staffing crisis really started, when COVID hit, and we haven't gotten relief yet. I'm personally hopeful we get a little bit of relief when, now that jobless benefits have run out in most states, and actually have run out in Ohio at the end of June, and we're starting to see workers return to the workforce, having spent down kind of what they sent. So a little bit of data on some of the challenges. What's interesting is healthcare employment across healthcare sectors is actually on the rise. So most healthcare sectors have rebounded. Obviously, the big dip is when COVID hit, but interestingly enough, in senior care, that hasn't happened. Employment has continued to drop, so it's exacerbating these problems and just putting a lot more pressure on us, right? And what we see is turnover is very, very costly. And Rob and Tony, I'd love to get your guys' perspective on this. Rob, you want to start?
Yeah, you bet, Mark. Thank you. Overall, if I remember correctly, I think it's roughly 40% of all of our post-acute workers, and that's combining clinical and non-clinical, are those CNAs and care staff kind of on the front line, making up roughly 80% of all the care that's provided to our residents, to our patients. And essentially, CNAs are the care, and the care staff are the face of our organizations to these residents and their families. And yet we're seeing roughly half of all of our CNAs never make it to their first year anniversary. This particular study estimated that the direct recruiting cost to replace a single CNA to be around $2,250. And for context, if you have 20 buildings and you're losing roughly 50% of your CNA staff, the hard cost comes out to just north of $500,000 a year just to replace them. And of course, that doesn't include using agency, using overtime, and the calculation of downtime or not being able to accept residents or patients during that time because of the lack of the staff. And so obviously this easily pushes that true cost up many multiples higher.
Tony, I was going to ask Tony for a comment on that as well. Tony, and what do you think about that number?
Thank you, Mark. Yes, the cost there on the slides, but there's another cost, and it's in regards to our quality of care. When we have high turnover, the numbers that Robert mentioning, we're seeing poor surveys, poor quality measures in regards to the care that we're providing these people. And again, Rob said these are the face of our people. CNAs are our backbones, and without them, it makes it very difficult to provide the care that we're required to provide and that we want to provide to our residents.
Thanks, Tony. So one of the things that we embarked on at OnShift about a year and a half ago was trying to get to know these frontline staff a little bit better. We interact with them through our platform on a regular basis. We're really starting a dialogue to understand them. We initially were going to launch the survey in spring of 2020. Obviously, we didn't do that due to COVID, but we did launch it this year. And so one of the questions we asked was, from both employees as well as leaders, what are the most critical personal challenges that caregivers are faced? And what's interesting to me is they differ, right? Burnout was first for both employees and leadership, although for leadership, they were more concerned about it. It was technically less of an issue for the staff than the leaders thought it was. Staying healthy was number 2 for caregivers. Fear and safety concerns due to COVID was what was assumed was second for leaders. Day-to-day financial struggles was number 3 compared to lack of childcare. Not enough me time was number 4 compared to additional family responsibilities. And those could be correlated. One could lead to the other. And then finally, number 5 for the employees was fear and safety due to COVID. And 5 for the leadership perspective was having to work multiple jobs. What I found fascinating about this is, as we think about retention strategies, what we need to do to maintain our staff levels, we've got to have alignment here. And from my perspective, number 2 being staying healthy, there's a lot of things we could do with providers to help that out, right? Many of us have fitness centers, wellness centers in our communities that we could allow our staff to use at certain times of the day. We all have food service operations. Could we deliver healthy foods and healthy food choices to our staff? So I think there's a lot to do that we can do, understanding what their real concerns and struggles are that don't necessarily need to cost us a lot of money, but could really move the needle from a retention perspective. Obviously, with the COVID mandates coming out, there's a lot of concern about what happens to staff there. I'm going to give you 2 points of data. This is a survey that we did right after CMS announced the mandated vaccines for just for long-term care. We surveyed long-term care staff and found out that 53% of unvaccinated staff would leave the sector and go somewhere where a vaccine mandate was not required. That's a little frightening. That's a total of about 20% of our workforce, because 38% were unvaccinated at the time of this survey. This was also before the government mandated the vaccine across all of healthcare. So there were other, potential other opportunities. I will tell you what we're seeing though when we talk to clients is it's not nearly that high. But this goes to the fact that we've got to do a good job of educating our staff and having a dialogue with them to make sure they understand the importance of this and the need to get it done. And right now, the last data that I saw indicated that CNAs were the lowest vaccinated of all of our workforce.
So, Tony, let me ask you, what is the panel's perspective of the impact of the vaccine mandate, and what are you doing about it?
I think there was a lot of fear before they mandated it across all healthcare. So I'm not sure that it leveled the playing field. However, that took away one option that our current staff members had, because we were hearing when it first was announced that it was only going to be nursing homes. We were hearing from a lot of our staff that then we'll just go work in the hospitals. We'll go work at doctor's offices. We'll go work somewhere else besides nursing homes. So while it hasn't completely leveled the playing field, because there's a lot of other obstacles that we're facing, mostly around wages. It certainly has helped us. And I also think it depends on the legality of the private employer mandate. And by no means am I a lawyer, so I don't want to weigh on whether it's legal or not legal and what's going to happen with it. But I think it's going to really depend, because you also hear our staff are talking about, well, we'll just go work at a retail, we'll work at Target or one of the retail companies out there that has not already mandated it. Mark, what are your thoughts?
Same exact thing. I think one of the things that we're seeing in customers that have mandated it is they're not losing anywhere near 20% of their staff. I've heard as low as 2 and as high as 4 to 5, but they're generally getting most of the staff over the hurdle. And a lot of people are looking at it as, look, I want to be able to go to my future residents and tell them my staff is vaccinated. That's going to help me, restore occupancy. Rob, are you seeing anything different?
Very similar numbers, a little higher with some organizations. I will say it's super competitive out there. And, actually prior to the mandate, we actually had some clients that were proactively starting to require the vaccination. But then we also had other clients who were openly telling us that they were waiting, and they were actually using this as an opportunity to hire away from those organizations who were mandating it. But they all kind of knew it was coming in terms of a universal mandate. And so they were kind of using those extra days and or weeks to try to, get some people in the door. And then when it was mandated, they could just say, well, it's not us, it's for everybody. And so I do think, the mandate, it does help level the playing field a little bit across healthcare or across the post-acute sector here. But just as Tony pointed out, I mean, when you start looking outside of healthcare, I think that's the biggest risk that a lot of our clients are starting to eye.
Interestingly, one of the trends I've seen in just really one or two clients is trying to target people that want to work in a vaccinated environment and say, you know what, we're safer here than going to work in a random restaurant where you don't know who's walking in the door. 95% of our residents are vaccinated and all our staff is. So there's an opportunity to kind of flip this and try to work it to your advantage.
Okay, and Tony, I'll throw it back to you. Given all the dynamics contributing to lack of engagement and decreased retention, what are the ways we start to overcome these hurdles?
In some of our most challenging facilities that have high turnover, low retention, we've actually gone back and have assigned dedicated human resource directors for these buildings. In the past, we were looking at having a human resource representative to cover anywhere from 6 to 14 buildings in a region. So with these centers, we've gone and done that so we can address the morale in the facility, have somebody that's there constantly listening to our staff members. So that's on the back end of it. And on the front end, we've also hired recruiters dedicated to these facilities. And again, they only have 1, maybe 2 facilities, whereas typically a recruiter has anywhere from again 16 to 14 facilities that they're recruiting for, and they can't really focus on that. So, and then we're getting out there and actually having small meetings with them, team huddles and everything, and actually listening to them, because right now people are exhausted and they just want to be heard. And they also we're also taking action. We've talked to some of our CNAs and our nurses, and there's like, you're giving all these sign-on bonuses and doing everything for trying to recruit all these new people. What about us? We've been here fighting this war with you guys. About us. So we've been listening to them, and we've added things like retention bonuses for some of our centers out there.
I think, Tony, I mean,
Rob's,
I think we also have to look outside of our healthcare industry to see what others are doing. And, when we look at, who are the fastest growing employers, and what are they doing to attract people? And, and obviously I'm a little biased on this point, but over the last several years, the fastest growing employers are those that are offering more flexibility. So, of course, the Ubers, the Lyfts, Grub, but even to the point that Amazon is recognized as one of the largest employers, and they're touting flexibility. I think that is something that we got to look at. And I read an interesting article this morning and posted on my LinkedIn, but it kind of caught my attention because it framed out kind of the nature of this shift of how people are working. And I just think there's a lot to learn from outside of healthcare that maybe we could apply to our own organizations. And then I guess, one other thought there, and, Tony, you touched on it, by adding more internal resources, is speed. If you have somebody that's interested in working with you, like, you can't wait, 24 hours and they're gone. So, you got to have that infrastructure in place to move quickly.
And Rob, that's another thing that we've done. I've given the authority to our recruiters to go ahead and source, recruit, interview, and actually hire a line staff, because the directors of nursing, your staff development coordinators, your CEOs, they are so inundated and busy still with COVID and the responsibilities of running the facilities. So that makes a difference, because before that, sometimes the DON was supposed to be conducting an interview, and she got tied up on a call, or they were doing COVID testing or something, and then we lost that candidate. So that's one of the other decisions we made with some of these centers that we're overseeing.
So I think part of the survey process that we did earlier that I mentioned was we asked, line staff, how satisfied are you with the level of support your organization provides to employees? And I think this goes directly to what Rob and Tony were just talking about. Interestingly, 10% were very dissatisfied, 10% were very satisfied. I was not surprised by that. Satisfied comes in about 28%, but neutral is, 32.5%, 33%. And I think the way I read this chart is, I am never going to convince the 10% that are very dissatisfied that I'm a great place to work and I'm a great employer. But if I can move that middle pile to the right, or a percentage of it, I think that's a huge win. And imagine if you could take 32% of your staff and put them in the satisfied or very satisfied column, the impact that would have on your turnover rates. It would drop pretty significantly. And at $2,250, per head, that's a lot of money. And that can really, really move the needle. So I would think about, what can we do to target that neutral group of employees, and go back to the previous chart I showed on what their challenges are, healthy, financial wellness, enough me time. What are some of the programs and things we could put in place to help move that population to the right, to either satisfied or very satisfied?
So, Mark, let me ask you, how should healthcare start redefining the path to employment?
So what I think is interesting about this question, Kim, is, we started a theme of redefining the employee experience a couple years ago, and consciously made a decision as a human capital management software provider to provide things that had benefits to the staff, right? Not just tools for the providers to manage their labor and schedule and stuff like that, but what could we do to impact the staff directly? And as I got into this industry about 10 years ago, everybody said, we're very resident centric. We do everything for the residents, and that's great. You need to be. But if you're also not employee centric, you're not going to hang on to your team, right? We've got to get better at reducing turnover and really understanding, who our team members are and what they need. And I applaud Tony. I think listening to people and communicating is number one. Interestingly enough, in the peak of COVID in April of last year, we saw staff satisfaction go up. And we peeled back the onion, and why is that? And the reason was we were forced to communicate with our staff more and get their input on how should we manage this? How should we do this? Do we have enough PPE? Do you understand our policies? Do you have childcare, right? So people were using our platform to engage with their staff at a much higher level, and it actually improved satisfaction. So I think you need to look at everything you do that touches staff. And Tony talked a little bit about this. I always tell people a really interesting exercise is take your marketing materials for residents and lay them next to everything you put in front of job applicants. And are you marketing to these applicants, right? Because in a lot of cases you're not. And I don't know about, Rob and Tony are probably somewhere in my generation. When we interviewed for jobs, the hiring manager was like, well, why should I let you work here? And today the employee is like, well, why should I come work for you, right? And we need to recognize that and adjust our approach and realize we're marketing to candidates as much as we are to residents.
Yeah, bravo, Mark. I think it's easy to point to how hard it is to compete against Costco, who's announced, $16 an hour minimum wage, or Amazon, who's now announced $18 an hour minimum wage, and it's easy to point to those things, but I also have to think, when we look at our retention and turnover numbers before the pandemic, like they weren't that good, So most organizations were struggling, like we saw earlier, to keep 50% of their CNAs in a given year. And I know we have clients that are, they're north of 80% turnover, in a given year. And so, when we look at that, I think the pain in a lot of cases was already there. And so, yes, while it's competitive with, against others outside of our industry, we are still seeing a large number of people express interest in becoming CNAs. And so, I know at Matchwell, we're partnering with several organizations to help train CNAs and build new pipelines for our clients. And I'm not trying to take away, from how difficult it is to retain people, but I do think there's an opportunity to invest in such pipelines. And, there's an opportunity for us as an industry to do something that maybe we're not that good at, and we'll call it branding. Our industry has something going for us that Costco and Amazon do not, and it's providing great patient care. And I think that, let's not forget that we can provide fulfilling work that really matters in a way that stocking shelves or boxing up items cannot. So, what are we doing to help tell our story and inviting those clinicians to see that this is where they want to be?
Yeah, Rob, I think that's
I agree,
an excellent
Rob.
point. Go ahead, Tony.
I agree with Rob. What we do in healthcare and take care of the elderly in other nations, the Scandinavian nations, the Asian nations, that's revered and respected. So I think our industry, we have to figure out a way to really brand, as Rob said, brand and promote what we do, because we change people's lives. We're taking care of people where families, they can't take care of themselves, or the families can't take care of them. And I just want to salute all the administrators and director of nursing and everybody out there that's been working in long-term care before COVID and survived through COVID. You guys are heroes out there, and what you do really matters, and you guys do a noble job, and I just appreciate everybody out there doing that.
That's a great point, Tony. Thank you. So another thing to do to improve your pipeline is look at organizations where you can build partnerships. There are plenty of them out there, so local faith-based, institutions, et cetera. And also, how can you recruit different types of workers? I think, we put an ad on Indeed. We hope people apply, but there's other things you can do. We've had clients target the slightly older population, the concept of 60-year-olds taking care of 80-year-olds, reaching out to local churches. There are a lot of people that are willing to work in our industry that may not want full-time employment. And to both Tony and Rob's perspective, flexibility is key. And what I've always loved about this business is we're a 24/7 operation, and we schedule our staff in 3, 7.5, or 8-hour shifts. But our business doesn't work that way, right? I'm busy in the morning, I'm busy in the evening. Why not add some 4-hour shifts and go see if I can recruit some people from the local church or other civic organizations to come fill some of those shifts? Because it can help and take a lot of pressure off your team members. Another interesting thing we had a client do was target former employees that left in good standing. Look, we have turnover. We're going to have turnover. They went back to 1,200 people that had been termed in the last, I think, 18 months. They ended up getting 400 applications out of that population and hired 60 people within a week. So just because someone left you doesn't mean they're not willing to come back. And a lot of people leave because the grass is greener, and guess what? It's not. It's just grass, like everywhere else. So think about ways you can target, passive candidates, populations that you may not be focusing on today, or ex-employees who know you. They know what they're getting into, and our data indicates when they come back, they tend to stay even longer.
So, Rob, let me ask you about recruiting. Are there other untapped markets we aren't utilizing to the fullest?
Yes, absolutely. The numbers don't lie. When we look at, I think it was Indeed that posted in 2019, and one of their surveys showed that there was a deficit in healthcare of about 500,000 clinicians, and that included care staff and CNAs. But they were measuring the number of job postings versus the number of hires in the industry, and so there was a deficit all along. But I also think that it's real important to realize that there are these resources that are simply underutilized, kind of to what Mark was just saying. We see that the majority of healthcare recruiting teams are barely keeping up with their full-time recruiting. And yet, when you look at all these workforce articles, they're all talking about the fastest growing segment of the workforce, not just in healthcare, but in all industries, are those people that are not traditionally looking for full-time work. And I think that's the opportunity here, even in healthcare. We often think about flex work clinicians as those that work through agencies. But I think one of the hidden stats that most people don't realize is that only 2% of clinicians work through staffing companies. Now, granted, in fairness, that was pre-pandemic. I do think that the staffing companies have done a good job stealing some people away, but we're not talking about a large number on a percentage basis. So the reality is still the majority of the workforce aren't working through agencies. So let's talk about those other resources and how can we target them as individuals that could be providing care in our facilities. The way that we kind of look at it is we break it apart to a couple different personas. The first one being moms. Traditional work hours may not work when they're thinking about their work-life balance and school schedules and sports and other things. And especially if they've got a partner or somebody else that's carrying the benefits or other things, like they want that flexibility. And how are we as an industry really tapping into that? We think about it in terms of retirees, those that are maybe looking to scale back a little bit. Well, we all know that we can't afford to lose any clinician from the industry right now. So how do we retain them for longer? And flexibility comes up time and time again. Also in terms of retention, what do we do when that CNA comes to us and says, I'm going to go work at Costco? Well, you've already made that investment into training them and getting them there in the first place. Instead of letting them walk out the door completely, kind of as Mark said, the grass may not be greener. Let's keep them in kind of a float pool or a flex pool where they could still pick up maybe 2 shifts a month in our building. Imagine if you had 20% of your CNAs that were leaving you pick up 2 shifts a month. Like that really moves the needle for our organizations. And then, of course, you kind of look at these other buckets, those that are working through agency, like we think you should hire them yourselves and have your own flex workforce without needing to go through an agency to get access to them. And then, candidly, the newest generation of workers. We've been reading about this for the last decade, maybe 2, as it relates to, they want to do good work, which is mission driven and everything. Well, healthcare has that. We check the box as it relates to doing good work. But second on their list, flexibility. They want that work-life balance. They want to be in control. Pay and other perks are further down the list. And so when we think about how to really tap into not just the underutilized workforce, but maybe the future of the workforce, I think it's different than the traditional 5-8-hour shifts that we've been so accustomed to. I think it's also important to point out that none of those personas that I just kind of rambled through are looking for that full-time work. And I do think that organizations that successfully target and can support flexibility as just a core piece of their workforce will have the upper hand in both the months and the years ahead in terms of hiring. And then I think also, just a point of clarification, the vast majority of clinicians want, I'll even say they need a full-time job. So they want to be part of something. They want to be part of a team. They want that continuity of a paycheck, to pay their rent, pay their mortgage, and other expenses, and providing for their family. So we're not talking about giving all of your employees so much flexibility that you can't staff your buildings. We're talking about a group of people that flexibility is top of the list, and how do we as an industry effectively meet them halfway and give them what they're looking for. So I think as we look at our full-time employees, like Mark said earlier, how can we give them a little more flexibility? Maybe it's a different start time or a different end time, et cetera. How can we still give them 40 hours, or in some cases even more hours, but give them a little bit more flexibility with that schedule? Then I think it's, how do we tap into those people that are not looking for that full-time work and actually build these internal pools? We've all called them float pools, or we could call them gig pools, or whatever you want to call them. They're all kind of the same thing. And we're not talking about people that they show up and then you never see them again. We're talking about building a pool of people that are continuously in your buildings. They're just not working on a fixed schedule every week. And then if you have a float employee or one of these flex work employees, and you don't have a shift for them to work, but they're looking for work, how do we make it easy for them to pick up work at maybe the facility down the street? And I realize that this could be scary because that facility may be owned by one of your competitors that you're competing against in recruiting staff. But the reality is, these people, if they're looking to pick up shift work, they can get that work by going through an agency. So how do we as an industry actually work together to maybe create this pool and let each other pull from it without the agencies involved? I was talking to a CEO of a post-acute organization. This is about 6 months ago. And within about 3 minutes of kind of having this conversation, he looked at me and he goes, I get it. If I do this in my own silo, I may benefit in my building. But if all of us in the industry do this together, the tide raises for everyone. And I think that's kind of the spirit of this opportunity here. And then I think finally, the third piece is we can leverage technology. Leveraging technology to make it easy for our workforce, whether they're full-time or part of a flex workforce, to pick up those shifts or maybe trade those shifts with other workers to give them a little bit of power and control in that conversation. And then finally, I do think that we have to think about things a little differently. The pandemic showed us maybe how vulnerable we were. And as a result, staffing agencies essentially won this battle. Nurse staffing, which includes CNAs, is up 95% year over year. And my guess is many of your organizations have increased dependency on agencies. I'd also say that most of you probably have a dependency on paying whatever they ask you to pay. And I personally believe that every organization should have their own flexible workforce that they can tap into. And I think if we build those different channels of different personas and different people that kind of make up our collective workforce, and we leverage the technology where we can see the data, we can actually help our schedulers make data-driven decisions on when and how to tap into these pools. And so, I think first and foremost, it's really helping our schedulers understand that we need to use our full-time employees to the most of our ability. If they need a little flexibility, let's give it to them. But let's maximize our utilization of those people. Then let's tap into this flex workforce that we're building together. And then tap into overtime. Overtime may be expensive, but at least that money's going into the pocket of the employee instead of the pocket of an agency. And so, then there's that overtime opportunity. And then finally, after we've kind of exhausted all other options, then let's look at more of those Band-Aid solutions like agency.
So, Tony, let me throw it to you. The workforce in senior care has a lot of moving parts. How do you improve the efficacy of scheduling?
Kim, I believe that we've got to rethink and we have to evaluate the way we've been handling scheduling for as long as I've been in the industry, for the last 25, 26 years. And we've, as Rob mentioned, we've got to leverage technology, and that's where Premier Workforce and Signature Healthcare has tapped into our partners at OnShift to use that type of digital technology. It makes, if you're using it, it makes scheduling so much easier. Granted, it's nothing's easy right now with staffing and scheduling due to the pandemic and where we're at with staffing that we've been talking about this last 45 minutes, but we really have to reconsider and who we place in those roles as well. Currently, most of the times we have a low hourly wage employee, typically a CNA, that is in this role for us, and many times they're wearing multiple hats. Not only are they our scheduler, but they're also medical records, or they're our transportation driver, or they're our central supply, or they're working on activities. So we really need to dedicate a full-time professional individual to that. And also, they have conflicting priorities. Sometimes it's just easier because they're using paper schedule. They know that they can go to those 3 or 4 either colleagues or friends, and they'll always pick up overtime. They won't say no. And you see these individuals working, 100 plus hours in a pay period. And I think Rob had a good point to that. Rob, you want to add something to that as well?
Well, I mean, I think when I think about this, I think about that scheduler who, I came from the staffing industry. So 2 decades in the industry, like, we trained our staffing teams on how to become best friends with your schedulers and to get to know their dog's name and get to know their birthday and send them the coffee gift cards. And it was all part of, we didn't want them asking, how much we were going to charge, or, we wanted to get the job first. And so we got very good at that. But then you've also got similar dynamics kind of happening within your building. The scheduler becomes friendly with some other workers, and all of a sudden you're using overtime when somebody else could have picked up the shift otherwise. And so I do think that accountability of using the systems that we've invested in terms of scheduling and then using data to make those decisions can help us.
Thanks, Rob.
Hey, Tony, one comment I would make on that. Yeah, if you don't mind, is I think the way to think about it is this person that's managing your schedule is managing your biggest operating expense, right? It's between 60 and 70% of your OpEx. They're not a scheduler; they're a labor manager that has a $3 to $5 to $7 million a year budget, and so we've got to give these people tools, as you mentioned, Tony, but also some training and some understanding. I think mostly a scheduler feels that their role is to fill the gap, right? Plug the gap. It's not fill the gap in the most cost-effective, meaningful manner, and we need to shift their thinking and encourage that kind of behavior. And I will tell you, what we see all over the industry is really poor utilization of our full-time staff. On average, it's about 77%, which means in a lot of cases, you're paying benefits for people that are not working full-time rotations, and you're paying overtime and agency costs to fill those shifts. So if you set your full-time equivalency for benefits at 30 hours, you'll find you've got a lot of people working 30 hours. If you set it at 34, 35, it forces that additional shift. And also have a conversation with the people that are tagged as full-time that aren't working. In a lot of cases, they're picking up extra shifts. We're just not putting them on the schedule on a regular basis. So make sure you understand the utilization and you're really able to manage as much of the full-time use as you can.
Yes, very, very good point. And I think it just isn't at the scheduler level. It's also at the nursing home administrator and director of nursing level. Within the last month, I had an administrator tell me labor management is not my responsibility. I'm like, it is your number one responsibility these days, especially in states like Florida, where we have minimum staffing requirements. If you don't meet those minimum staffing requirements, then you have to suspend admissions for a week. So we've got to make this a priority in our industry, in our centers, and it starts with leadership, and it also goes down to our schedulers. Some of the things that we're looking at doing is making this a higher pay individual and being dedicated to just scheduling and coming into our morning meetings and providing that information. Where are we at? How many people can we admit today? I think there was a recent article, I think in Provider Magazine or Florida Healthcare Association, that said 50% of nursing homes in the state of Florida are either restricting or denying admissions due to staffing. I mean, that's very, very, very concerning when you're an operator that you cannot admit patients because we don't have the proper staff to do so. The other things we're doing. No,
go ahead, Tony.
Go ahead, Mark.
Like I say, it's what a horrible position to go through COVID, see occupancy drop, wait for it to rebound. It finally starts to rebound, and we have to turn people away.
Definitely, and the hospitals don't understand that, so we've got to educate our hospitals as well and say, this is what we're going into, and this is why we can't admit patients today, because we just don't have the staff, and they're going through the same thing as well. I mean, we've even they've asked us to open COVID units, and like, if you can help us with staffing and provide some of your staffing, we're more than willing to open another COVID unit in the area and assist the community. However, they're not able to do that as well. So I think it's really rethinking the way we've been doing things for forever in the long-term care industry.
One of the things that I hear frequently. Sorry, I want to talk about the higher pay thing, because most people think they can't afford that. And what I would tell you is, back to Rob's point on retention, if you want to agree that $2,250 is a good number to replace a CNA, and it's fine. I think it's anywhere between $2,000 and $3,000. And if you multiply it out, let's say in Rob's example, it was a $500,000 cost. That's your budget and your pool to raise wages and provide employee rewards, right? If you can do things that chip that away, that's the pool you can do. And it's very easy to trace that, to see, if you implement a rewards program of some sort, does it move retention down in a short period of time? If you raise wages a little bit, does it move retention up? I'm sorry, we want retention to go up. So you're spending the money today. If you add up overtime, agency, and turnover as a dollar, that's your bucket, and I guarantee you it's a bigger bucket than you think it is. That's your bucket to go spend to try to do some of these programs to get better control over turnover.
I get real excited when I hear Tony talk about the kind of the raising of these schedulers, kind of raising the profile and investing in them, maybe paying them more, investing in training, trying to retain them as long as possible, and really make that the core piece of their business. Because I think, as you pointed out, Mark, when they're managing 60 to 70% of your P&L, and then they're the same person that we're having turnover issues with, and oh, by the way, they're out on the floor, 80% of the time. I think that's probably one of the biggest opportunities for us as an industry, is rethink the scheduler role. So I really like that, Tony.
So, Tony, let me ask you, given all of these dynamics, what is needed to streamline these efforts?
I think Rob and Mark, and I've talked about some of them in the previous slides, things like having a dedicated recruiter and giving them the authority to interview and hire your line staff, and taking that burden and those steps, off of the director of nursing, off of staff development. I also look at making scheduling and using the technology, again, like we use on shift, or watching some of these buildings, and we're paying for the technology, but yet only 40% of the facilities that we're managing, we're using the technology. I'm like, this is a non-negotiable. And so one of the things we do is we reach out to our partners at On Shift, and we make sure that the scheduler, whether they've been in that position for 6 months or for 6 years, or they're brand new, that's part of their onboarding. That they're going through this training. And then Rob and I worked together with Matchwell and Signature, and we've talked about things like centralizing scheduling. If you've got a cluster market where you've got 2 or 3 buildings in a vicinity of each other, why not centralize that and let one individual try to manage that? And that's some of the things that we're piloting and seeing how that works out for us. And also not just to elevate the scheduler and pay them more money and get a professional that's dedicated, that has the acumen to be able to look at these cost impacts, whether you use overtime or agency or an organization like Matchwell, but also incentivize them. If they're able to eliminate agency out of your facility, that could be $100,000, $150,000 a month. If they're able to take your overtime from 15% to 10%, that being able to incentivize them pays for themselves 10 times over. Rob, anything you'd like to add to that?
No, a big exclamation point. No, I think you nailed it. Let's not be afraid to incentivize our people to make the right decisions. And if we equip them with the tools and hold them accountable, let's also share with them and reward them for being successful. I mean, getting rid of that agency, those are real numbers, and so let's not be afraid to put some bonus dollars their way to make sure they keep that agency out.
I would think that we talked a little bit about this, but I think, Rob, you mentioned being the speed to hire has got to improve. Good candidates, A, they apply for 4 or 5 jobs at a time. They don't apply for one job. And B, they're generally off the market in 3 to 4 days. We see over and over again when we talk to people before their clients, their hiring process is the supervisor collects applications and looks at them on Tuesday and Saturday, right? Well, if somebody applied on Saturday after that supervisor's cutoff, they don't get connected until Tuesday. And then the person calls them. And I'll tell you what, if it's a millennial, they don't know that you can speak on this, right? They don't know that this is a telephone. So you can text them, but you've got to look at your hiring process and identify where the bottlenecks are and just take them out and make sure you've got as streamlined a process as humanly possible. And I also would hit hard on the look at your data. Don't just look at payroll. Don't look at your P&L. Look at your utilization. Look where you're having gaps. One of the challenges that we always see with agency, and everybody's using it now, it's the easy button, right? If I pick up the phone and call my agency provider, I've solved my problem. I've got somebody that's going to fill that shift, but it's at a really suboptimal cost. So really understand what you can do with your own team first, and really get very, very good and efficient at all these processes around hiring, scheduling, managing, and retaining. So I think we're going to turn it up for questions now.
Okay, well, thank you, gentlemen, for that great information. Now we'd like to take questions from the audience. Anyone with a question can type it in now using the questions and answers tab on the left. We'll get to as many questions as we can in the remaining minutes. So we do have a few questions coming in. Mark, I'm going to start with you. Are residents or families asking about vaccination percentage of staff at facilities?
We are hearing that they are, and Tony, I'm going to go to you in just a second. We are hearing that they are, and if you're not aware of this, CMS is now publishing vaccination rates as of 2 days ago in Nursing Home Compare. So they can go online and see what your vaccination rate is among your staff. Tony, are you hearing this from families?
We definitely are, Mark. They want to know, what percentage we're at, and as you mentioned, CMS is now made the announcement that they're going to post that on the Nursing Home Compare website or some website, so family members and potential clients can see that information.
Yeah, it went live 2 days ago. They're posting it.
Okay, for Mark and Rob, how do you approach your CEO to increase your CNA or CMA pay? They start them at $11. That's ridiculous.
I mean, I can jump in first. This is a conversation we have with clients every single day, and it's hard when you don't have the data in front of you. So I'm going to start by saying get the data, and I know all three of us on this call can help you, but you can also go to Google. Like, there's so much data to show you what others are paying and what you're competing against. I think you got to arm yourself with that data. I think there's also a secondary piece, especially if you're using agency in your buildings, because those agencies don't care what you want to pay your internal staff. They can pay whatever they want. And so would you rather pay your people a couple dollars more, or would you rather pay $25 more for somebody to put that same person back into your building through an agency? So again, I think the data will actually show you what you can afford, and more importantly, how you have to think about this. But again, I don't think the agencies are going to go away anytime soon unless we better compete. Because if you're that CNA and somebody's offering you $5 more an hour to work across the street, that's what they're going to do. And so, yeah, we talked about some other stuff in terms of branding and patient care and other things, but we do have to be competitive on pay with what they can get elsewhere. Mark, would you have anything to add to that?
Yeah, I think the biggest problem I see is people don't really have the understanding of what turnover costs. And so I always encourage providers to build a cost of turnover calculator. ACA has one on their website. I believe we have one. And it could be as simple as, what do we pay for advertising? What do we pay for Indeed? How much time does it take to interview and onboard a new staff? So your building level or management has a number associated when somebody leaves, right? You can say Rob quit. Well, $3,000 just walked out the door. What could we have spent to save Rob, right? And if you start identifying those costs, then you can compare over time. Are you doing things to move the needle, as I mentioned sooner? But get an understanding in your building of what turnover actually costs you, because it's not a GL line item. So nobody knows. And they never do the math. You've got to understand how much money's walking out the door when a staff member leaves you.
Rob, we have another question I'm going to send your way. How do we take these staff from agencies who are paying $10 to $15 more an hour?
So this is tough, guys, and you're not going to want to hear maybe my answer. Hopefully Tony or Mark can give you more soothing news. But step one, you don't. Step one is you're not going to get them onto your payroll for $10 less. Step one is we have to find ways to engage them. And I'm not trying to do a plug for Matchwell, but find other partners that can help you kind of compete against the agencies. But you're going to have to compete on pay with what the market and or these agencies are paying. So it's kind of like you got to stop the bleeding, with a nice tight tourniquet before we can actually solve the problem long term. Step two is once we get control and we've stopped the bleeding and paying those excessive agency rates and others, then we can start looking at what should pay rates be. And we can start looking at, it's more than just hourly pay, the different types of benefits and other things. What does that total package look like? If they're looking for flexible work, maybe pay them a couple dollars more, but they don't get the continuity or they don't get first dibs on the best shifts. Those go to your full-time people. And so there's a way to kind of prioritize your full-time people who get the most perks down to the others. But for some people, they're chasing that dollar or they're wanting that flexibility. I don't think you need to be thinking about those people as who you're trying to actually source for your full-time employees. I think they're two separate buckets altogether. Mark or Tony, I don't mean to, cast a cloud of doom. Any thoughts on your end?
Yeah, I do. I think your point is spot on, but also know that there are a number of people that are working for agencies today that would rather have a full-time job, and they want that full-time job because they like the sense of camaraderie, getting to know the residents, the families, etc. And in some cases, it's pay, but in a lot of cases, it's not. It's flexibility. Right? I can only work 3 days a week because I've got childcare. So can I work 3 12s instead of 3 8s so I can have, closer to full-time employment? Or can I work 3 12s and you can pay me 40 hours, for the flexibility. So there's a lot of ways to skin the cat. Don't assume it has to be a dollar for dollar match from a wage perspective.
Yeah.
Okay, Tony, we have another question. Do you think incentives should be offered to HR staff?
Good question. HR staff. Good question. If they're going to help, if you can do a ROI and they can help with retention or recruiting, just depends on what you have your HR staff doing. Like I said, we're looking at incentivizing our scheduler. So yeah, I think we've got to look at all kind of different creative ways. But if you can look at things and there's going to be a bottom line impact, whether it's savings, whether it's getting rid of agency or it's improving retention, I definitely would support that.
Okay, and here's one for all of you. Can you speak more to the flexible scheduling? Any advice on how to start the conversation about introducing flexible scheduling?
Tony, I think you should start with that because I think you've implemented it.
Yeah, I mean, a lot of it is based on COVID. We've just found it easier to manage 12-hour shifts, or we've worked with recently where we bring people in for 4 hours in the morning. Where we have our heaviest load with getting residents up, medication passes, meals, and then they come back. They're able to go home because they either have childcare needs or they want to be there to pick up their children from school. And then in the afternoon, they come back and they help us in the next heaviest load, which is the evening, where we still have med pass, we have meals, and then we're putting everybody back into their beds and providing the ADL care. So I think those are some of the things that we've got to do. And you just start having the conversation with your staff. Go into the break rooms. talk to them, have team huddles, and talk to them on individual basis or small groups, and they'll share with you. And you just got to figure out how to implement it. It's not easy, I can tell you that, and that's why I'm talking about having a different level in your scheduler, because it's the challenge to manage those type of schedules. But if you can start matching those people up, and you can get 2 people to do those types of things, or you get 4 people to do those types of things, it makes it much more easy to implement, and also makes it a lot more easier to manage.
And Tony, I'm going to go back to you. Are you seeing successes in internal staffing pools?
We are. Sometimes it's a little bit slower than we would like, because we need staff today. We can't wait. But yes, we've actually created an internal pool called FlexPath within Signature, and we have. It just depends on the markets, but we have seen success. And again, then we've partnered with people like Rob at Matchwell to be able to supplement that as well. So some of our buildings have been agency free. I'm hoping to get all of them agency free sooner rather than later. But those are the types of things that we have had success on.
Great. And then I with maybe asking each of our panel members, for a key takeaway from today's presentation. What would you like attendees to leave with?
I'll start. I think a couple things. One is the situation that we're in right now doesn't go away anytime soon. So to the extent that we've not changed our approach to how we staff, schedule, and retain employees, we're just going to be in this endless cycle. So you really got to look at it. I think we've tried to give you some good ideas. My hope whenever I do a presentation like this is everybody gets one nugget that they can take back to their building and make an impact. So I think it's really think about what we talked about today and what you think would be the biggest needle mover for you, and go back and experiment and implement that. But just don't rely on the status quo, because things aren't going to get better magically anytime soon. Rob?
Well, I should have gone first, because that really, you said it beautifully. No, I think it's identify how you and your buildings and your organization, identify the status quo, as Mark said, and just start a conversation. My personal bias is there's a growing workforce of people that might not be looking for what you're offering. It's a provocative question. Start there.
And I would conclude, as leaders of your facilities, labor management is your number one responsibility these days, and rethink who you have in that scheduling position. They really need to be your right hand, just like your director of nursing is just married to you at the hip. That your scheduler needs to be married to you at the other hip.
Great. Well, thank you, gentlemen. We hope you found today's webinar helpful. This session will be available. Special thanks to our speakers, Mark Woodka, Robert Crow,